In discussing matters climate change, these are issues of absolute importance to us in reproductive health, particularly in adolescent reproductive health. We see that climate change forces situations and social determinants of health to be altered, to be changed. And persons who are affected by the climate change to change their everyday lives to be able to accommodate what is happening to the environment. We are talking changes in temperature, rainfall, and such. So we get persons who are affected by climate change moving from one region to another, lacking food, lacking basic necessities. How does this affect adolescents? Wow. When it comes to the reproductive health of adolescents, we are talking something that affects the very foundation of their wellness. Because for their reproductive health, we are talking for the girls, issues to do with access to sanitation facilities, menstrual products, and the like. Unfortunately, we are seeing a situation right now where young girls are trading themselves and their bodies to be able to get even sanitary pads. Why are they doing so? Because the situation is dire. There's no food, there's no water. Even the sanitary pads are a luxury. Unfortunately, we saw during the COVID period that the sanitary pads can be provided in school, but when they're at home, and even for the adolescents and young persons who are at home, not going to school, they are lacking access to these commodities. So you're getting these children being exposed to early unintended pregnancy, HIV, and other STIs. Now you see, this is a problem. Why? Because this child who is below 18, for us to name them an adolescent, this child is unable to accommodate taking drugs every day. They don't fathom that. Their brains don't accommodate that very well. And without a stable family that helps them and supports them to be able to deal with these issues, one after the other, if it's not the pregnancy, it's the HIV or the STIs or other stigmas that surround these reproductive health concerns. If they don't have the support, we get even suicidal and mental health problems. So this issue, reproductive health, being affected by climate change is multiplicatory, in effect. It's just growing and growing. So if we don't deal with climate change, we expose our children to situations that are bigger than we actually have anticipated. We as a Ministry of Health are looking into putting out a policy that's going to address adolescent and young persons' reproductive health. And it chooses to represent these issues comprehensively. What are the determinants of health that are pushing the adolescents towards early sexual debut, for example? It could be poverty. It could be lacking even those health facilities and even information regarding their reproductive health. So the policy is going to address the issue comprehensively to be able to see how do we stop the tap from continuing to flow. Fine, we can address the pregnancies as an issue of concern directly, but we will not have addressed the causes of those pregnancies, and we will not have addressed the GBV that may be resulting in our communities. Because if you're going to engage in early sexual intercourse with a child below the age of 18 years old, I want to inform us clearly here today that within our Children's Act, that is illegal. We should not be marrying off our adolescents. But why are we doing so? Climate change. We should not be exposing our children to FGM. Why? When they go through FGM, unfortunately, culturally, they are taken to be mature, but they're still children. So these children should not be exposed to these harmful traditional practices, which may be resulting from the climate change that we are exposed to. Using climate change as a strategy, climate change and mechanisms to avoid or curb the effects of the climate change, I believe very firmly that we will be able to curb some of these causative factors that are harming our children and our young people. So basically, if we continue watching as our trees get cut, watching as our water levels go low, watching as our crops fail, we most certainly will continue to see very adverse effects in adolescent and young persons' reproductive health.